Australia, New Zealand, the virus essentially has been suppressed. Yes, sporadic outbreaks, but not mass death. We're in a situation of all of the worst. We have mass deaths. We don't have a recession. We have a depression, and it's going to be a depression as long as this epidemic is not in control. And when Trump talks about looking after America first, he has put America into the worst disaster in our modern history, the worst disaster since the Civil War, I would say. And it's unbelievable, whether it's on the economics, on the health. This man knows nothing, learns nothing, is vulgar, attacks, and has put our country at the greatest risk we have ever been in, certainly from a national leader of this kind. So the answer is, this is a controllable epidemic, and it is being controlled in many, many countries of the world. But our leadership is so blind and repressive that even when we have wonderful experts like Dr. Bright, who knew it from the start, he was repressed by these political hacks, starting with a vicious know-nothing president and then going with a crony who heads the Health and Human Services Department till today, so that the professionals are unable to speak in this country.
So I think a lot of economic experts and health experts believe that this president is putting the United States at risk of a societal collapse, as close as we've ever been to one. So, Dr. Dave, there is one way to end this, and that would be a vaccine. Dr. Bright yesterday in his testimony definitely poured cold water on the potential that a vaccine would be ready in less than a year. There is some studies, Oxford one, that showed that there is real promise in the fight and in the investigation to get a vaccine. But do you agree that it's a year away? And what do you know about certain vaccines? There's one that uses gene therapy to help fight the virus. How does it work? How is it different than others? And are we a year away?
Most experts are telling us that it's a year away or more. There are now over 100 companies engaged in developing vaccines of different types, from attenuated to inactivated viruses to little particles of viruses to this new, rather exciting gene therapy method using the adeno-associated virus, which is a cold virus. All of this is wrapped around the concept that we are going to decrease the number of cases eventually in the United States with a viral vaccine. This question of globalism, though, I can't help but get to that, Mika, if you would allow me, because Please. We are going to reach 100,000 patients soon that die in the United States. The Bill and Melinda Gates Foundation is recommending that we consider the more global indirect effects on very young children in low-income countries. 250,000 kids in that age group, up to 1 million, will die based on some modeling out of Canada in 6 months from indirect effects of this pandemic, from lack of antibiotics, lack of oral rehydration therapy, lack of enough food. They will die of a slow, wasting starvation. So it is important to know that there are viral methods in place that use cold viruses that will perhaps allow us within months or a year or two to have a vaccine. But I would challenge all of us that we can look a little more expansively across the globe and realize we have it bad, but poor countries with lots of kids that are starving to death with disrupted health systems, they have it worse, Mika.
Yeah, Willie?
Dr. Wen, you, as we mentioned, ran the Health Commission in Baltimore. The CDC put out new guidelines yesterday. Finally, they were revised, put through the White House, and a pared down, as we said earlier, sort of a Cliff's Notes version of their original proposal. It was a checklist, basically, for businesses, for schools, for mass transit systems, and things like that. Here are some broad ideas of what you should consider when you're deciding whether to reopen. What does a city like the one you live in and work worked in. What does a state, what does a governor, what does a mayor do with the information now from the CDC? Because it is so broad, and effectively what the White House and the CDC guidelines are saying, it's up to you.
Yeah, that's exactly right, Willie. This is not what we're used to seeing from the CDC. Look, I went to the CDC website every day in the middle of the Zika epidemic, when we had measles outbreaks, Ebola. I mean, we saw guidance from the CDC all the time. And what we look for from the CDC is specific, direct information. We don't have this. I'm not used to seeing this vague, waffly language as what was produced yesterday. I mean, yesterday, the guidelines were things like encourage social distancing, encourage the use of masks. That's not helpful. I have businesses in the city and around the country that are asking me exactly what should we do. If we're opening a restaurant, reopening a restaurant, how far away should the tables be? Should there be partitions of a certain height? If museums are going to be open, which galleries should be open and which ones should be closed? If we're changing our ventilation system, what is it that we should be looking for? I mean, businesses need this information, schools need that specific guidance. Also, individuals want that too. How do you know which businesses are safe to go into, which schools and daycare are safe to use? That's what the CDC is really good at. They can translate that scientific research into actionable information. And somehow the CDC is not doing that anymore. And I fear that it's because of political interference. And if we ignore the science and don't let scientists speak, then unfortunately we are going to see more infections and more deaths that are easily preventable in this case.
So, Dr. Jeffrey Sachs, the White House has lied repeatedly about the previous administration's preparation and work on these issues. They blew off the playbook that was given to them that actually had specific mentions and warnings about the coronavirus in it. They blew off and fired everyone in the pandemic office. They did not take any of the warnings that came their way, including one from former Vice President Joe Biden in January. And they've now put out a pitiful pamphlet of common sense recommendations as to how to get through this. What advice could you give to governors and mayors who actually want to lead their constituents through this crisis?
It's hard with the death of the federal government. We have turned everything over to local action in a country where people move around, where the infections spread, where state and local governments don't have CDCs. So we really have the death of the federal government right now. And as a president, we basically... the only analogy I can think of is if Joe McCarthy from the McCarthy era had become president. This man, in his venom and his paranoia, makes claims, waves papers, says worst crimes. He's such a despicable human being, but he's actually blocking the capacity for national action. What I would say to governors and mayors is you've got to trace every case every day. People who are confirmed should be called. Are they safe at home or do they need to be moved to quarantine? The number of mistakes, by the way, being made at the state and local level is also shocking. Putting infected people from hospitals into nursing homes in my own state, it makes you cry because thousands of people are dying unnecessarily. We're so unequipped, and we have this vulgar fool who is blocking all the action at the national level. We can't really do this without a national government. Trump has to stand aside and let there be a serious response so that this country doesn't have a Great Depression and this calamitous death toll. They go together. There is no economic health trade-off. That's the biggest lie. Unless this epidemic is controlled, our economy will stay in depression.
Oof. Doctors Leana Wen, Dave Campbell, and Jeffrey Sachs, thank you all very much for being on.